IRG's Health Talk continues.
All right, our first guest today is Teri Low-McGavin, a physical therapist at IRG Physical Hand Therapy in Murphy's Corner location in Mill Creek, talking about accidental falls, the common causes, how they can be prevented. And Shannon, this is something that I've kind of become more acutely aware of late. As you know, I've had knee and foot and back issues now. I have actually fallen down 3 times over the last 10 days, just walking along, and suddenly my knee or my hip has given out, and I'm on the street or on the sidewalk. It's scary, and I'm anxious to hear what she has to say about some of the causes.
And you're not the only one out there that is concerned about falling. Falling is a significant problem in our society. I mean, I think every 15 seconds someone falls in the United States. So falls are out there, and we can help. And that's what Teri does.
All right, let's listen to Teri Low-McGavin and Shannon O'Kelly.
Teri Low-McGavin, welcome to Health Talk. How you doing?
I'm doing great, Shannon.
Thanks for joining us. I'm excited to talk to you. September is Fall Prevention Balance Awareness Month, so to speak. We know the stats. I mean, they're staggering how many people, particularly the elderly, fall. I think I read something where every 15 seconds someone is falling in America. That fall results in some kind of moderate to significant injury, hospitalization. I mean, as we get older, our muscles get weaker, our balance gets impaired, our vision, all these things are going on in our body, and we're susceptible to falls, and falls can be prevented, particularly in the hands of someone like yourself. You're a vestibular balance physical therapist. Tell me and us, our listeners, about your practice, how long you've been doing, how long you've been a physical therapist. Give us the Teri Low-McGavin story, okay?
All right. Well, I've been a physical therapist, I think, for about 39 years now, and 20 of that has been with IRG. And back in, I think it was 1997, I attended a conference, and in that conference, they told me that if you are over the age of 65 and you have a fall, that there was about a 50% chance that you could be dead in a year because of the consequences of that fall. And so when I heard that information, I just really felt like it was something I needed to get involved in. And so about 1 out of every 4 people over the age of 65 in the United States will fall, and about 3 million of those people are seen in an emergency department because of the fall, and about 800,000 people end up being in the hospital because of the fall, and usually that's due to something like a fractured hip or a head injury.
Yeah. You and I both being physical therapists. And hey, thank you for the 20 years of service here at IRG. It's been a great ride, Teri. We are very thankful that we have someone with your skills and your knowledge to run and develop and help with intervention with some of these falls and vestibular. I mean, this service, I don't think the general public really sometimes understands the amount of services and education that physical therapists have, particularly in these specialty areas, this balance, vestibular, fall prevention. You just gave us some demographics. I mean, we know it's the elderly population. You and I both know that if you fall and fracture your hip, particularly in your age of 80 or something like that, that's going to be a hospitalization, and there's mortality that goes with that. So preventing these is really important. Maybe you can describe to our listeners as a physical therapist kind of what your approach is and how you can help people with fall balance risk management.
So initially the patient is referred by their primary care physician usually, and they will come into the clinic and we'll spend probably 15 to 30 minutes talking about what's been going on in their life, if they've already had a fall or if they just have some concerns about falling. We'll do an assessment that looks at their strength, their range of motion, their balance, whether they have any specific vestibular issues that might be coming from their inner ear or their brain. And then taking all that information, we will design a specific exercise program for them that's designed to decrease their risk of having a fall. So they might do strengthening exercises, stretching exercises, general balance exercises, or specific exercises designed to improve the function of their inner ear if that's warranted. We also talk about things like environmental hazards, things that they could change in their homes in terms of rugs or wet floors or clutter, stairs, those kinds of things, footwear, proper clothing, encouraging people to get vision checkups every year, keep their glasses clean. And one thing that's come up in the past year and a half is the fact that wearing these masks affect our vision, and it's very hard to see the ground sometimes when you have a mask on. And so we've actually had several patients who've had a fall because of their masks, unfortunately.
More with Teri Low-McGavin and Shannon O'Kelly after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hudler and Shannon O'Kelly with more IRG Health Talk.
We're talking about accidental falls, how to prevent them with Teri Low-McGavin and Shannon O'Kelly on Como.
So joining us on Health Talk today is Teri Low-McGavin. As Teri mentioned earlier, she's a physical therapist, multiple years of experience and several years of experience, especially training in vestibular, which is dizziness and balance problems, balance awareness and education, and fall prevention. We know September is Fall Prevention Awareness Month. We know the stats. They're staggering how many people fall in America. Every 15 seconds there's a fall. Teri, in your experience, what is the thing that stands out when someone comes in for assessment? Is there something that is some kind of common denominator you see in almost all your patients?
I'd have to say probably one of the most common things is just deconditioning. Get a lot of people that get to the point where their legs are so weak that they can't rise from a chair without using their hands significantly. And that's a really important functional thing just in terms of gauging a person's strength. And so I see a lot of people that have either health problems that have caused them to get weak, or they've had a fall, become fearful of having another fall, limited their daily activities, and that has led to them becoming weak.
Yeah, it's kind of interesting that we're having this conversation. No kidding, maybe in the last 2 weeks, I've probably gotten 3 calls or texts from people that I know that have inquiring, what can you do? My mother, my father, someone in their family is all of a sudden experienced some unsteadiness and has maybe already fallen and luckily wasn't hurt in the fall, but the family is aware of that. What can we do to help the family, and what can the family do?
I think doing things, like I mentioned a little bit ago, keeping the vision really good, getting checked up once a year for vision. If there's any history of foot pain, getting a check every year for foot pain to see if that's a factor. Environmental hazards, so making sure the home is a safe place to be. Encouraging the mother or father or significant other to use gait aids like canes and walkers if it's needed, and just encouraging the person also to share with their physician that they're having difficulties. Less than 50% of the people that have a fall tell their doctor. And if you don't tell your doctor, the doctor can't do anything to help.
Sometimes, it takes a little bit of coaxing, a little bit of talking, a little bit of education. Sometimes people just don't want to change. So getting the family involved, getting the therapist like yourself involved is a significant intervention. Is there any time that you probably should reach out, or you find as a therapist that there's a medical condition that needs to be looked at as we wrap this up?
Yes, I have quite a number of people who come in with numbness in their feet that turns out to be some type of neuropathy, and that significantly affects balance. I also get a lot of people who've actually had vertigo or dizziness and have never shared that with their doctor, and so getting them to share that with a doctor to come up with a significant diagnosis, a specific diagnosis for that is really important. So those are 2 really common things that a lot of times people haven't even shared with their physician that I can kind of nudge the patient in the right direction and then also send some information to the physician in my initial evaluation so that can be checked out further.
That's exactly what I was looking for, Teri. Hey, Teri, again, thank you for your time and thank you for your experience and your knowledge and the service you provide to our patients here at IRG. Very much appreciated.
You're very welcome.
Lots of things to take in there, Shannon, from Teri Low-McGavin. Falls can be very dangerous. We used to laugh at the I've fallen and I can't get up commercial. There's really nothing funny about it.
No, there is nothing funny about it because a fall can result in significant injuries, hospitalizations, and sometimes just never recovering from that fall. So the nice thing about it, someone like Teri, in her hands, we can help you.